How do you prevent cancer?
How do you prevent cancer? Guess what? A whole food plant-based diet. And, it's being a little flip, but let's talk about this. The very act of cooking meat, nobody eats raw meat. The very act of broiling that steak, grilling that chicken breast, frying that burger, you inevitably create, as the DNA and the proteins in that animal muscle get cooked at hundreds of degrees, it produces some very potent cancer-causing molecules, aromatic polycyclic hydrocarbons. These are carcinogenic, and they rub on the stomach wall, they rub on the colon wall, meal after meal, year after year, and there's no question the meat eaters get more colon cancer, more stomach cancer. But also these carcinogenic, cancer-causing molecules get absorbed into the bloodstream and they're sent to other tissues. We find women with breast cancer that have more of this of these carcinogenic hydrocarbons, not only in their breast tissue, it gets in the breast milk. What's that doing to the baby's risk of a leukemia or something down the road there? So a meat-based diet is a major player in cancer formation. Plus, as I mentioned a while back, when you eat meat, your liver responds with a gush of hormones called insulin-like growth factor 1, IGF-1. It's one of the most powerful growth-promoting hormones in the body. And it's fine if you're a growing child, you want lots of IGF-1, yay, grow big and strong. But if you're a woman with an early breast cancer or a guy with an early prostate cancer growing, the last thing you want is a diet that produces gush after gush of IGF-1, this growth promoting factor. And the meat eaters, when they do develop a cancer, it grows faster and more aggressively. And so it's another big flashing sign where we are not carnivorous apes. We are not meat-eating hominids here. And so I'm not saying it's the total answer. Certainly cigarette smoking plays a role, the pesticides, the hydrocarbons in our drinking water. Well, there's a lot of carcinogens around, and no question. And genetics plays a role. If a woman, if her mother, two aunts, and a sister all died of breast cancer at age 30, and clearly she's got a genetic propensity. But still, all the more reason that she shouldn't wave the red cape in front of the bull there as far as her diet goes. She should be extra vigilant to eat a stabilizing, non-carcinogenic diet. So again, stay out of carcinogenic, cancer-causing situations. Don't smoke. Don't be breathing auto exhaust. And you may laugh, but if you're standing on the street corner and a bus is coming by with all sorts of fumes spewing out the back, don't breathe that in. As the bus or the truck is coming, as they approach, take a deep breath in. And then as they pass and lay out that plume of carcinogenic fumes, and you got to walk through them to get to the other side of the street, breathe out as you're walking. And don't make that one little step not to breathe that stuff in. When you're filling your gas tank up, don't keep your face poised over the nozzle and breathe in all those carcinogenic fumes. Turn your face upwind and breathe the fresh air coming in. So take those little steps to avoid as many carcinogens as you can and keep your inner tissues healthy with a plant-based diet. And don't eat a lot of sugar as a food. And those are the best steps I can give you to avoid cancer.
How do you prevent diabetes?
How do we prevent diabetes? Such an important question. It's one simple little question, but it opens the door to some very important physiology, because if you ask people what caused diabetes, eating too much sugar, high sugar, high sugar. Turns out that in the most common form of diabetes, type 2 diabetes, over 90% of people with diabetes have type 2. It's not the sugar causing the problem. That's the tail of the dog. That's the last thing that goes up. The problem is the fat in the diet, the vegetable oils, the meat fat, the dairy fat, the fat in our own bodies as we become obese. All this fat clogs up the insulin receptors in our liver and our muscle cells, and they inhibit enzymes. So when insulin from the pancreas knocks on the door of the muscle cells saying, hey, we got sugar out in the blood, let's move it into the sugar, into the muscle to burn it. If the insulin receptor mechanism is all clogged up with fat, the insulin, I can't respond to insulin's message here, and the sugar stays out in the bloodstream and builds up to high level, and that's where the high blood sugar comes from. But it's not the cause of the problem. It's the result of the fat clogging up the action of the insulin receptor enzymes. So if people go on a low fat, whole food, plant-based diet, the fat clogging up the insulin receptors is metabolized for energy. The insulin receptors open up, and the glucose intolerance goes away. The diabetes goes away. So a low fat, everyone needs some fat, but I'm talking about get it out of whole foods and not out of an oil bottle. Get a handful of walnuts or some ground flax and hemp on your cereal, some olives on your salad. That's where to get your fats, not out of glass bottles. So if you eat a low-fat, whole food, plant-based diet, the odds of you developing type 2 diabetes could fit in a flea's navel, really small. And so that's the best way to avoid diabetes. Whole food, plant-based diet, low in fats, then only comes from a whole food source, those fats. Take a walk every day. That's important too.